Hello, welcome to my channel. Subscribe or like if you like it. Today we are going to talk about the medicine fluoxetine. We will explain its mechanism of action, its side effects, its dosage, its uses, its contraindications, its warnings, pregnancy and indications. The trade names of fluoxetine are Prozac, Serafem, Prozac Weekly, Rapiflux. Fluoxetine mechanism of action: selectively inhibits the reuptake of serotonin by CNS neurons. What is fluoxetine and what is it used for? Therapeutic indications and dosage of fluoxetine. Oral route. Adults and elderly. Major depressive episodes, recommended, 20 mg daily. Review and adjust if necessary within 3 to 4 weeks after initiation of treatment, and thereafter as clinically appropriate. Maximum 60 mg per day. Minimum duration 6 months. Obsessive-compulsive disorder, recommended, 20 mg per day. If after 2 weeks the response is insufficient, increase gradually up to a maximum of 60 mg. If there is no improvement within 10 weeks, reconsider treatment. Maintain treatment beyond 10 weeks in those patients with a response. Long-term efficacy has not been demonstrated, more than 24 weeks. Careful and individual dose adjustment, to keep the patient on the lowest possible effective dose. Periodically reevaluate the treatment. Bulimia nervosa, complement to psychotherapy, 60 mg per day. Efficacy not demonstrated for more than 3 months. In all indications, doses higher than 80 mg per day have not been evaluated. Elderly not to exceed 40 mg/day, max, 60 mg/day. Children older than 8 years and adolescents. Moderate to severe depressive episodes, if no response to psychological therapy after 4 to 6 sessions, initial dose, 10 mg daily. Careful and individual dose adjustment, to keep the patient on the lowest effective dose. After 1 or 2 weeks it can be increased up to 20 mg per day. Reevaluate treatment after 6 months for responding patients. If clinical benefit is not achieved in 9 weeks, reconsider treatment. Mode of administration of fluoxetine. Oral route. Administer in single or fractionated doses, during or between meals. Contraindications of fluoxetine. Hypersensitivity. In combination with MAOIs, do not initiate treatment until 5 weeks after discontinuation of fluoxetine or with fluoxetine until 2 weeks after discontinuation of the irreversible MAOI and the day after with reversible MAOIA. Warnings and precautions with fluoxetine. Hepatic impairment, history of seizures, unstable seizure disorders, epilepsy, mania, hypomania, bleeding disorders. Hepatic dysfunction. Patients with congenital long QT syndrome, family history of QT prolongation or other clinical conditions predisposing to arrhythmias, such as hypokalemia and hypomagnesemia, bradycardia, acute myocardial infarction or decompensated HF. Diabetes. ECT, elevated intraocular pressure or at risk of narrow-angle glaucoma. Concomitant with, oral anticoagulant, drugs that affect platelet function or increase bleeding risk. Careful follow-up in patients with a history of suicidal events and with a significant degree of suicidal ideation before initiating treatment. Children and adolescents under 18 years of age, if a decision is made to initiate treatment, monitor the appearance of symptoms of suicidality or mania, hypomania and follow up on pubertal growth and development. Gradually taper the dose over a minimum of 1 to 2 weeks to avoid withdrawal symptoms. Risk of akathisia, psychomotor restlessness and ventricular arrhythmias. Avoid concomitant administration with tamoxifen. Fluoxetine hepatic insufficiency. Caution, decrease dose. Interactions with fluoxetine. Contraindicated with, MAOIs. Potentiates action of, drugs metabolized by CYP2D6, adjust to the minimum therapeutic range those of narrow margin, for example, flecainide, enconide, carbamazepine, and tricyclic antidepressants. May reduce the effect of, tamoxifen. Potentiates the effect of, oral anticoagulants. Risk of occurrence of serotonergic syndrome with, tramadol, triptans, lithium, tryptophan, selegiline. Increased adverse effects with hypericum perforatum. Avoid with alcohol. Pregnancy and fluoxetine. Some epidemiological studies suggest an increased risk of cardiovascular defects associated with fluoxetine use during the first trimester of pregnancy. The mechanism by which they occur is unknown. Epidemiologic data suggest that SSRI use in pregnancy, especially in late pregnancy, may increase the risk of persistent pulmonary hypertension in the neonate, ppHN. In addition, although fluoxetine can be used during pregnancy, caution should be exercised, especially during late pregnancy or just before delivery, as some effects have been reported in neonates: irritability, tremor, hypotonia, persistent crying, difficulty breastfeeding or sleeping. Lactation and fluoxetine. Fluoxetine is excreted in breast milk, so caution should be exercised when fluoxetine hydrochloride is administered to women during lactation. Effects of fluoxetine on driving ability. Fluoxetine may produce sedation, dizziness. Therefore, patients should be instructed that if they experience sedation or dizziness, they should avoid performing potentially hazardous tasks, such as driving or using machines. Side effects or adverse reactions of fluoxetine: decreased appetite, insomnia, anxiety, nervousness, restlessness, tension, decreased libido, sleep disturbances, abnormal dreams, attention disturbance, dizziness, dysgeusia, lethargy, drowsiness, somnolence, tremor, blurred vision, palpitations, flushing, yawning, vomiting, dyspepsia, dry mouth, rash, urticaria, pruritus, hyperhidrosis, arthralgia, frequent urination, gynecological bleeding, erectile dysfunction, ejaculation disorder, nervousness, chills, decreased weight, persistence of sexual dysfunction,